The point of order has been withdrawn. The chair recognizes Dr. Oliverson.
Mr. Speaker,
Ms. Johnson, for purpose.
will the gentleman yield?
The gentleman yield for questions.
Yes.
Gentleman yields.
Thank you, Representative. I just want to talk about some of the substance of the bill itself.
Okay.
Now, your bill would exclude all access to hormone therapies, puberty blockers, and surgeries for transgendered youth seeking health care. Is that correct?
Under the age of 18, yes.
Okay.
Except in certain...
But I was going to say, but you do have exceptions in the bill, correct?
That's correct.
And so there are exceptions for allowing puberty suppression and blocking drugs for children with precocious puberty. Is that right?
That is an abnormal medical condition, so yes, that's right.
So why is that an important exception?
Because that is an abnormal medical condition as opposed to a mental health condition.
And so what defines it as an abnormal medical condition?
It is a known medical diagnosis where the hormone production in the body proceeds at an earlier stage in development than it's supposed to, and so it's abnormal.
Well, so you would agree with me then that in that particular situation, it's perfectly acceptable for these medications to be used. Is that right?
For a completely different reason, yes.
But regardless, it's acceptable. Is that right?
Yes.
Okay. Now, there are other situations where these kinds of medicines would be appropriate. What about children who have to use high-dose chemotherapy? Is that another example where hormone treatment might be appropriate?
I'm not advised, Representative.
Well, you're not advised? You're a medical physician.
Sorry.
So when you have to go through high-dose chemotherapy and to treat any conditions of various cancer treatments or whatever, oftentimes hormone replacement therapies are used because that chemotherapy can have a negative impact on that, correct?
That would be a child already under puberty at that point. And we wouldn't be talking about cross-sex hormones either. We would be talking about same-sex hormones. So
there's all
I think
kinds
that's
of
a
hormones.
strong distinction between what we're talking about here.
Not necessarily. I'm asking
No,
if...
necessarily. It would be a
no.
completely different scenario.
You are having a bill
We're trying
here.
to restore, in that scenario that you describe, you are talking about restoring somebody to a normal endocrine axis, to a normal physiology. This bill is about abnormal, actually intentionally, iatrogenically changing somebody's endocrinology to other than what it was intended to be.
That is your opinion of what is abnormal.
No, it's not my opinion.
No,
that's medical fact.
My question is really focused on the use of the medications in general. This bill is not intended to prohibit the use or the application of these medicines, period, in any circumstance, correct?
This bill is intended to prohibit the use of these medications for these specific purposes.
So I guess the answer to my question is yes, in that you are not intending to prohibit, outright ban the use of hormone therapies and puberty blockers in any scenario. You're only intending to use them for this specific scenario as outlined in this bill. Is that correct?
I am prohibiting them when their use would be to contradict and destroy the normal endocrinological, physiological pathways that would manifest during puberty.
Okay,
the situations that you describe are none of those situations.
Well, so then I take it as my answer is the answer to my question. It's a simple yes or no question. My question is
well, I'm sorry that you think it's simple yes and no, but it's actually not.
I believe I get to ask the questions. We've established that this session. The question is very simple in that you are not trying to, by this bill, outright ban the use of these medications in every scenario, correct?
I am not trying to ban the use of these medications in scenarios where they are used to attempt to restore normal human development.
So you would agree with me then that there are situations where usage of these medicines are medically necessary and appropriate?
I would agree with you that there are situations where these medications are used in an attempt to restore normal human development, and that is exactly the opposite of what this bill bans.
Yeah, normal as you define it, but not necessarily normal
as is defined for more than 100 years in healthcare.
So you have also, in this body, you have frequently advocated for parents to have the right to make important medical decisions for their children. Is that right?
I do.
Yeah. And you have frequently articulated that that is often medical decisions are best made between patients, their parents, and their medical doctors, such as in the use of vaccines. Is that right?
To be clear, this bill is not about parents. This bill is about bad medical practices.
That's not my question.
I'm
My
giving
question
you the
is,
answer to the question that you're
frequently
asking.
articulated the rights of parents to
answered your
make medical
question,
decisions
Representative.
with respect to their kids. And an example of that would be vaccines. Is that right?
I've answered your question.
And so, but in this particular context, you are absolutely prohibiting parents of transgender youth from making the medical decisions that they feel necessary for their children. Is that right?
No, actually, that's not correct. What I'm doing is removing inappropriate, experimental, and harmful medical practices from the practice of medicine in Texas. This isn't about parents. This is about medical practice.
Yeah, there's
That's
plenty
the purpose of
and
this
there
bill.
are plenty of physicians within the state of Texas that completely disagree with you.
And there were plenty of physicians that disagreed when we sought to rein in the abuses during the opioid epidemic as well. But sometimes the state has to act for the betterment and be the adult in the room and point out to medicine and science, or point out to medicine, I should say, when the science is heading this way and you're heading this way.
But you haven't
and this
outlawed
is not the only time
you haven't
you've done
outlawed the
this.
use of opioids in the state of Texas.
No, but
What
we
you
have
done is
regulated
you've
them.
left it to doctors to exercise their appropriate medical discretion of when and how opioids should be used and
Actually,
prescribed.
I think we've done far more than that on opioids. And I
Doctors
think
are
the
still able to
majority of
prescribe opioids in the state of Texas to their
doctors
patients.
must comply with the Medical Act's restrictions on the provision of opioids.
Doctors are still able to prescribe opioids to their patients in the state of
Doctors are
Texas.
still able to prescribe these
Right.
medicines, but in circumstances where there are clear benefit in correcting abnormal physiology.
So, in this bill, you also have a weaning off provision. Can you explain that, please?
Sure. I think let's see here. Let me find it. Okay. So it begins on the bottom of page 3 and then goes on to page 4. So basically what it does is it outlines a scenario where a child may have been on these medications for a prolonged period of time, and there is no science, there is no scientific guidance as to the process for removing those medications, how quickly it would be done. We know that it can be done, it has been done, but there's not good guidance. And so what we did is we established a provision that tries to, I think in a very careful way, outline that if a child meets certain criteria for having been on one of these medications for a prolonged period of time, that there is a process, an off-ramp, if you will, whereby that person can be weaned off in a, I think the bill says, in a manner that is safe and medically appropriate and minimizes the risk of complications.
So you would agree that it would be medically inappropriate to abruptly remove patients who've been using these medicines for a prolonged period of time, to remove them from it abruptly. You agree with that?
I think that there certainly would be a concern. I think that we do know that, in particularly in the case of cross-sex hormones, that the use of those drugs can actually suppress the body's own ability to make their own hormones and essentially make the person dependent. And that may take some time to correct. And it resolves typically, but it takes time. And we can't say statutorily what that exact window is going to be. And I would also point out to you that these medications have strong psychoactive effects. These medications can be mood altering. So it seems to me that it would be prudent, as we're searching for the least invasive the least invasive thing that we can do, the least harmful thing that we can do for these patients is to provide an off-ramp.
So just the net effect of the off-ramp is that there will be a period of time under state law where some children will have access to these medications while other children will not. Is that
clear? Well, to be clear, they'll have ability to continue the medication they're currently on and no more.
Yeah. Thank you.
Yes, ma'am. Thank you. I do have an amendment. Oh,